Okay, this lecture is going to be on collaboration and informatics. So, preparation for the class, make sure you read the following from your book, The Essentials of Nursing Leadership and Management, Chapter 7, Communicating with Others and Working, Chapter 8, Resolving Problems and Conflict, and then Chapter 16, What the Future Holds, and then if there's any other readings listed in the syllabus, please review those as well. The objectives of this lecture, so collaboration, we're going to learn how to analyze the factors that affect collaboration in healthcare, examine essential aspects of collaboration in nursing practice, differentiate between different types of interdisciplinary and intradisciplinary groups in nursing and healthcare delivery, and then delineate amongst strategies for conflict prevention, response, and management. Also, objectives for interdisciplinary teams. We're going to examine the purpose of healthcare teams, compare and contrast the characteristics of an effective interdisciplinary healthcare team, analyze strategies to promote interdisciplinary collaboration, determine the components necessary for effective interpersonal communication, investigate the benefits of engaging an interdisciplinary team in the planning and implementation of patient care, and explore the importance of interpersonal collaboration. And then the objectives for informatics is we'll be able to differentiate the two types of healthcare information systems and their goals, the EMR and EHR, contrast the advantages, applications, and legal implications of telehealth, explain the value of utilizing a uniform nursing language when documenting in the electronic health record, summarize the role of informatics in nursing research, and relate how informatics can improve the delivery of care. So let's go ahead and start by looking at communicating with others and working with the interprofessional team. So as a little warm-up, we want you to do an exercise on communication. So in level 1, you learned a lot about communicating and pretty much have discussed how to communicate every term since then. So to review, what are examples of verbal versus nonverbal communication and what it means to say they are not congruent? And then look at how might cultural differences affect these, someone's emotional state, and what is the difference between assertiveness and aggressiveness? Give an example. So go ahead and pause at this point and complete those questions and review communication. And then moving on, I want to say that communication involves the spoken word as well as nonverbal messages, the emotional state of people involved, outside distractions, the cultural background that affects their interpretation of the message, all affect how people communicate and how it's received. So going into assertive communication, it requires an individual to firmly state his or her position in statement. So assertiveness assumes greater importance as nurses need to act as patient advocates to ensure that patients receive safe, effective, and appropriate care. And using assertive communication helps in expressing your ideas and positions. So, what are some barriers to communication? There's a grid here that you can look at. There's physical, cultural, organizational, interpersonal, and linguistic. So breakdowns in communication attribute to about 50% of preventable errors. And then again, those barriers are listed there in that table. There's also another table on page 103 in your book. It's 7-1, which also lists more barriers to effective communication in healthcare. And these include low health literacy. So there's a lack of the skills needed to access and use health information. Cultural diversity, which impedes the ability to access, understand, and utilize services and information. There's cultural competency of healthcare providers. There's the lack of the ability of healthcare providers to identify and consider cultural practices, along with communication skills of healthcare providers. So, healthcare providers lack the training needed for communicating with each other, such as interprofessional communication. Okay, electronic forms of communication. So, in information systems, there's communication through the use of health documents. Surprisingly, this is all fairly new developed technology. The Health Information Technology for Economic and Clinical Health Act mandated the use of electronic health records. They also developed Medicare and Medicaid financial incentive payment programs. There's electronic medical records or EMRs, which is more of a record of care within the institution. And then there's electronic health records or EHRs, which provide other information beyond data collected by providers. And it's information from all clinicians involved, so not just one office or one institution, it's a combination. What are the advantages and disadvantages of an EMR? Well, it enables providers to track data over time. It identifies which patients need preventive screenings or checkups. You can monitor patient status, such as their blood pressures, blood glucose, vaccines, lab work, trends. You can evaluate and improve the overall quality of care within specific practice because you have sort of a timeline of treatment that they received. So some disadvantages is that it, often requires a lot of printing to share with others. There's concerns about confidentiality and HIPAA, and really it's difficult to move out of the specific provider practice or healthcare institution. Especially if the facilities are not affiliated, then it's time consuming. You have to print, you have to fax, and a lot of times it gets lost in communication. So I think that's why a lot of providers now are moving more towards electronic medical records. Okay. Advantages of an EHR: documents are shared among institutions and individuals. They focus on the total health of a patient. They provide a more inclusive view of a patient's care over time. Designed to share information with all other healthcare providers. They assist in maintaining patient confidentiality. Decisions regarding care can be made quickly. You have that trend of data, and then errors are reduced, safety is increased, and quality is improved. All right, information systems in many institutions allow access to high quality clinical and research data to support evidence-based practice. So benefits of information systems, you can see box 7-1 on page 104, which has benefits listed, including increased hours for direct patient care. Patient data is accessible at the bedside and convenient. You have improved accuracy and legibility of data. You have immediate availability of all data to all members of the team. There's increased safety related to positive patient identification, and then improved standardization and improved quality. There's decreased medical errors and increased staff satisfaction. Also, information systems need to look at patient confidentiality, so there should be policies in place in each facility regarding passwords and HIPAA, etc. All right, email. So, we all know what email is. It's used both within and outside of organizations. It's the same communication principles that apply to traditional letter writing, which should apply to email. Requires good writing skills. There's rules in the workplace which are different from personal email. There's netiquette. It's box 7-2 on page 105. And some netiquette rules include if you were face to face with this individual, would you say this? Follow the same rules of behavior online that you follow online with dealing with individuals personally. Send information only to those individuals who need it. Avoid flaming, that is, sending remarks intended to cause a negative reaction. Do not write in all capital letters. This suggests anger. Respect other people's privacy. Do not abuse the power of your position. And then proofread your email before sending it. So, a good rule to follow is do not send anything by email that you would not want published on the front page of a national newspaper or broadcasted on your favorite radio station. Text messaging, definitely it's evolved as a quick method of communication. I'd say over the last maybe 5 years, it's really started to become something that hospitals and institutions are looking into implementing. So it's a brief, informal method. There really, unfortunately, I mean, generally speaking, there's no laws about texting yet. However, many employers do have policies and procedures in place that may limit personal cell phone use during work hours. Um, the lack of nonverbal communication can be a little confusing. Business consultants predict that this communication method will evolve and become accepted when providing simple Q&A to coworkers. It's also important to follow the same rules that apply to email. So, another concern with text messages is that they can stay on devices indefinitely, which can leave personal health information unsecured and accessible to unauthorized users. Secure text messaging is being developed and is being used in some healthcare settings. I guess they're looking into trying to create something that is HIPAA compliant electronic communication that is still HIPAA compliant, that allows exchange of information in a timely manner without creating a risk to patient privacy and confidentiality. I would expect, even within the next 5 years, to see many, many more advances of this technology in the future. And I can say that when I was working in the last facility, there were several providers that kind of under the table would text message us nurses at work if there was something that we needed from them. Of course, the orders were all electronic orders for the providers. So if we needed something, we would text them and be like, hey, can you give this order for this patient? And then they would enter in the order themselves. So there were some concerns with that because, again, it wasn't a regulated, it was sort of under the table text messaging that we would do. But I'd say, if anything, it was a very, very rare occurrence. But the providers that were involved were definitely interested in implementing something like that in the future. And it's much easier and much quicker way to communicate. Okay, reporting patient information. So, handoff communication, as you know now, is a huge part of nursing. So, previously referred to as change of shift report in nursing, which I think we still say in general. A move toward an interprofessional team philosophy has changed the way reports are given, just like we do bedside report now, too. It ensures continuity of care from one area to another. It's part of the Joint Commission National Patient Safety Goals. Information required. So if you see box 7-4, page 107, has some good information. And then also on Moodle, I will be releasing a handoff procedure for bedside report that Riverside Regional Medical Center um, provides to their nurses there. So I will release that shortly. So another consideration with handoff communication is when we talk to healthcare providers, such as physicians, can be very intimidating. And we want you to kind of be prepared on how to do this process and to become more comfortable with that process. So best thing you can do is to be extra prepared. So make sure you have all the information available that you need. Expect them to ask you detailed information. So majority of the time when I would speak with a physician, I would try to be right in front of a computer with the chart accessible so that it was much quicker for me to be able to click to look at labs that I wasn't expecting this provider to ask me about, trends, etc. So try to prepare yourself for the unexpected and for questions that you might not think they would ask. Um, Especially know why you are calling. Um, a lot of these providers, if they're seeing hundreds of patients in a hospital setting, they won't even know who you're calling about. The name might sound familiar, so you're essentially telling them a story. You're telling them a story about your patient, why you're calling, what's the background. You kind of give a general description. They're here for surgery, they had this complication. I'm calling because I would like, or I feel the patient needs. So be prepared, again, to provide general assessment information. Um, and then pertinent information, at least most recent vital signs and trends, laboratory values, medications, and times the patient received the most recent dose. And then once you do actually talk to the provider, you want to make sure that you document everything appropriately. So you want to make sure you document the time of the call in the patient record. If the healthcare provider needed to return the call, document the time the call was returned in a healthcare provider call log. A lot of times I would document the time that I paged the physician or doctor and then the time that they called me back. And generally speaking, they would be fairly prompt calling you back, but there would be providers that you would have to page multiple times. And it was important that I wrote down the times that I paged them to see, well, how long are they taking in between pages? Or, it's been 10 minutes. I should probably try paging the physician again. I haven't heard from them. Follow the chain of command. So if a call's not returned within the appropriate amount of time, and it'll vary by facility, um, especially the time of day, and if it's day shift, night shift, if it's a teaching hospital, are there residents, etc. And then two, if you do receive an order, make sure you document it properly. You've recorded, and which means you write it down, physically write it down, and then read back what you wrote down to the physician for verification. You should be very familiar with SBAR as of this point, but it's good to review page 110, table 7-2, lists a little bit more detailed SBAR. It has introduction, situation, background, assessment, recommendation, and readback. And it explains the elements of, they say, ISBAR, and it provides descriptions and examples of each element. So just some good information to review. Okay, case study. So I'll kind of have you work on this a little bit on your own, but I'll read it. So Mr. Williams, he is 65 years old, presents to the ED with shortness of breath. When asked the reason for coming to the ED, he tells the nurse that he called his healthcare provider, who told him he should go to the hospital. The nurse obtains a health history and conducts an assessment. During the history, the nurse notes that Mr. Williams needs to stop after every 3 words to catch his breath. He also states, I gained 10 pounds during the last 2 weeks and I have this dry cough. So, pertinent assessment data, he has a temp of 37.2, heart rate's 148 and it's irregular, respirations are 28, blood pressure's 176/104. Mental status, he's mildly anxious, concerned about his increased blood pressure, and worried about getting to his afternoon meeting. Priorities, Neuro, he's awake, alert, oriented to person, place, and time. Perla, EOM, smooth. Respiratory, dyspnea noted. I would expect that. Bilateral breath sounds, medium rails throughout the lung fields. Cardiac, he denies chest pain. His heart rate is irregular. Shows atrial fibrillation on the monitor. Looks like might be a murmur noted at the fifth intercostal space. Peripheral vascular, he has bilateral 2+ edema noted on his feet and ankles. So, after reviewing that table in your book, use the IS bar format to create a fictitious report to the healthcare provider related to pertinent information from the case. And what is the most pertinent information you need to share to this patient's provider? And looking at his case, I would definitely want to recommend the most pertinent things that we're finding. So it looks like his heart rate's definitely elevated. It's irregular. He is tachypnic with a respiratory rate of 28. His blood pressure is it is elevated, 176/104. He has this edema, 2+ noted. Throughout the lung fields, he sounds with rales throughout. He's mildly anxious, gained the 10 pounds in 2 weeks, has a dry cough. So those are all things that I would want to make sure to share to this doctor. I mean, I can tell you it's a congestive heart failure. Whether it's an exacerbation or not, I don't know what his history is, but I would expect to give him a little Lasix. Okay, so work on your IS bar report for that, and then if you'd like, we can go over it in class next week. All right, so healthcare provider orders. RNs, nurses, we are responsible for accepting, transcribing, and implementing healthcare provider orders only from credentialed providers for the state you are working. So there's written orders, telephone orders, which it may vary by facility, so make sure you know your policy. These orders need to be signed by the healthcare providers. So be sure you write it down, read it back to them for verification. Do not just repeat it back and then write it down. Typically, with electronic medical records and with Epic and the system that Riverside has, it will prompt the physicians to sign off on orders that are entered by nurses. Fax orders, make sure you know the policy needs to be signed by healthcare providers. And again, too, that'll go with prescriptions and whatnot if you're faxing to a pharmacy, a local pharmacy, or if you're calling in prescription for a patient. So make sure you know the policies. And then EMR orders or physician order entry. Okay. Questions. So we called the healthcare provider. He gave us a telephone order for stat furosemide 40 milligrams IV now. I want you to create a narrative nurse note reflecting your initial communication with the provider, the telephone order, and your overall evaluation. You may want to practice using the PI format, problem intervention and evaluation, to guide your documentation and ensure it is thorough in future practice. So you can pause right now and complete that note. Okay. Working in teams. So, working in teams in nursing, how do you feel it will benefit you as a nurse? So, it brings professionals together. You know that each of you has a common goal, which is to provide quality patient care. You have a collaborative focus. And then CUSIN has a definition of working in teams as the ability to perform effectively within nursing and interprofessional teams, fostering open communication, mutual respect, and shared decision making to achieve quality patient care. So, a working team, you should try to be an effective team player. So, see box 7 5, page 112. It lists qualities of an effective team player, which include they demonstrate dependability, they communicate constructively, engage in active listening, they actively participate, they share information openly and willingly, they support and offer assistance, display flexibility, exhibit loyalty to the team, act as a problem solver, and they treat others in a courteous and considerate manner. So make sure that the team members understand each other's goals and they're committed to achieving the outcomes. And then act as a role model and exhibit expected behaviors. Okay. Interprofessional collaboration and the interprofessional team. So, interprofessional collaboration is based on the premise that when providers and patients communicate and consider each other's unique perspective, they can better address the multiple factors that influence the health of individuals, families, and communities. No one provider can do all of this alone. So it occurs when multiple health workers from different professional backgrounds work together with patients, families, caregivers, and communities to deliver the highest quality care. So there's a link to an article, Interprofessional Collaboration and Education on Moodle. Please go ahead and read that. Effective interprofessional teams. So again, there's another box, 7-6 on page 113, that explains effective communication through conferences. So it also focuses on the needs of patients and clients. Each member of the team has roles and functions that contribute to patient care. And then each member of the team contributes and is also valued. And then you monitor and evaluate the effectiveness of the team goals. So members of an effective interprofessional team provide care to a common group of patients. They develop a common goal for patients or clients' outcomes, and then they work together to achieve the goals. Members have roles and functions and understand their roles and the roles of others. The team develops a mechanism for sharing information. And then the team creates a system to supervise the implementation of plans, evaluate outcomes, and make adjustments based on the results. Okay, review questions. I think we're just about done. So, review questions. Make sure you navigate to the book publisher website and enter the Essentials of Nursing Leadership and Management textbook resources. Click on online review questions and then click on each chapter, chapter 7, chapter 8, and 16, and complete the review questions, please. And then that concludes this lecture. Thank you.